Medical marijuana is a hot-button issue in California. There are arguments going both ways as to how easy the substance should be to legally obtain, if at all. The continuing disappearance of medical marijuana dispensaries and what that means for different parts of the industry. Straight ahead on Equal Time.
From San Jose State University, you're watching Equal Time, exploring new issues each week, giving equal time to competing points of view.
Hello from the campus of San Jose State University, and welcome to this edition of Equal Time. I'm your host, Journalism School Director Bob Rucker. According to federal law, in the United States, marijuana of any kind is illegal. 15 years after medical marijuana was made legal in California, cities and counties all over the state are now trying to either regulate or ban the clinics completely. Tim Vantress reports on how this affects people in what is now a full-blown industry.
At Oaksterdam University in Oakland, students take classes on subjects not typically found in a CSU or a UC. They are taught about the politics, prohibition, and proper care of medical marijuana. Self-employed handyman Mike Mendez is here for his own education.
This is actually my second class here. I came here last month for the beginner class. I'm back this month for the advanced class.
Students attend seminars and even learn firsthand how to grow cannabis. If students don't have a medical marijuana card, they work with the herb rosemary instead. Another student who wishes to only use his first name, Michael, is taking these classes to consider a new career. He used to arrest people for using the substance he is now studying.
I used to be a former police officer and ended up hurting my back and having over a dozen surgeries.
Oaksterdam opened its doors in 2007 and has since taught 15,000 students combined in Oakland, Los Angeles, Sebastopol, and Ann Arbor, Michigan. However, people wanting a future in handling pot may find their profession is shrinking. Medical marijuana clinics have been disappearing all over California, and the same can be said for the marijuana job market.
The job market for medical marijuana is looking rather bleak due to the recent federal interference.
Dale Skye Jones is the executive chancellor of all 4 campuses and has been with Oaksterdam since 2008. Her hope is for schools like Oaksterdam to help legitimize an industry that is widely scrutinized for its illegal activity.
Oaksterdam University has brought unbelievable opportunities, not just for me specifically, but more importantly for the patients and the individuals who are trying to learn how to involve themselves in the cannabis movement or the cannabis industry and be part of the solution rather than part of the problem.
The illegal activities are spurning local governments to regulate and even ban the growth and distribution of medical marijuana. In San Jose, a city ordinance in September of 2011 put strict regulations on clinics in the city's boundaries.
We're trying to set up a system, a regulatory system, to allow clubs to operate in San Jose, provide the medicinal marijuana needs of people who need it. And so that's what we're trying to do. I don't favor a ban because that would be the alternative.
Not only were clinics required to grow their product on site, but they were limited to 2 per district. The number of collectives in the city would have been reduced from more than 140 to 10. According to the ordinance, the clinics would have to apply for a permit to be one of the remaining 10. It would have been first come, first serve. One of the clinics fighting to stay open was High Standards on the outskirts of downtown.
I think the city council obviously has to please the side that, that really doesn't want cannabis to be this approachable, to be this accessible, and I think that they really do have to please that side as well as us.
Bud tender Bo Dufresne says High Standards has thousands of patients in its database, and most of the product is grown off-site. Dufresne says it might be difficult to meet the demand if the dispensary couldn't use separate facilities for cultivation.
I don't think they quite know the demand and the supply. I don't think they quite know that ratio yet, especially when the product does come. The medicine does come from different areas and different people. So one thing that I think if we end up having to grow our medicine on site, the demand isn't going to be met, especially when the clubs are limited down to 10.
Another concern for bud tenders is if they were to get the permit to stay open, too much attention would have been drawn to themselves for federal raids. A more personal concern, however, is keeping a job. Jeff Ryman had been working at High Standards for 5 months.
I'd be unemployed. I'd be standing back in line. I have kids. I have family. This is my family also, and I don't want to lose them.
By now, the San Jose marijuana industry would have been turned upside down if it weren't for city voters turning in nearly 50,000 signatures to be able to repeal the ordinance on the June ballot. However, the cannabis clubs got some good news.
The City Council did a U-turn and rescinded the entire ordinance this February 14th. Council members concluded that the difference between federal law and state law prevents them from creating any ordinance that adheres to both levels of government. For now, the dispensaries have some breathing room. For now, cannabis jobs in San Jose are safe.
When we come back, we'll show you the argument for government officials and those who say the industry built around cannabis is an industry running rampant.
We have over 140 of these clubs operating without rules, regulations, or anything.
Welcome back. Now that medical marijuana is legal in California, some government officials are trying to put a clamp on the industry they say is out of control. Once again, Tim Vantress.
Medical marijuana is an ongoing issue in California. The city of San Jose is now starting to take action. The challenge for Mayor Chuck Reed and the rest of the city staff is finding a balance between state and federal law.
And one of the difficulties for a city is trying to figure out what the rules are when the state says one thing and the federal government says another.
Under federal law, marijuana is illegal. But 16 years ago, California passed a proposition that allowed medical patients to own and cultivate marijuana. 9 years ago, the state expanded on that by establishing the marijuana card system and adding additional rules for patients. By August of last year, San Jose housed more than 140 of these dispensaries. However, there was a problem.
They're all illegal under our existing ordinance.
In the eyes of the city, dispensaries have always been illegal. The only reason the clinics still operate is because of the city's lack of manpower to police them all at once. Regardless, the City Council passed an ordinance last September allowing 10 collectives to operate under strict regulations.
We established a limit of 10, primarily because that's how many we think we can handle administratively to get through our process and to be able to establish the regulatory system that we're trying to put in place.
City voters then submitted nearly 50,000 signatures to try and put the idea of limiting the number of dispensaries on the ballot.
So we'll start with 10. If more than 10 seems appropriate, we'll deal with that later.
The future of marijuana in San Jose was in limbo until this Valentine's Day. The council unanimously approved to rescind September's ordinance, instead appealing to the state Supreme Courts in Sacramento.
The City Council has debated the issue for nearly 2 years. As of right now, the discussions have come full circle, ending right where they began. Back to formula.
The main reason for the sudden change is finding the balance between federal and state law. Councilmember Sam Liccardo says that under federal law, not even pharmacies can deal the drug.
Pharmacies are prohibited from distributing any drug that is prohibited under this Controlled Substances Act, and that's within what's called Schedule 1.
This directly contradicts California's Proposition 215, where pot can be used for medical purposes. The courts now have the job to better define what cities can do within the law.
I think the Attorney General is appropriate in asking for greater guidance from the legislature. And again, even there, I don't know how long that will be.
Until then, the the city is targeting clubs that have been accused of not paying their full taxes or causing a nuisance. Mayor Reed says as the laws are written right now, there can be no ordinances across the state that follow both federal and state law.
It's impossible to have an ordinance that's workable from the marijuana collective's point of view and still comply with state and federal law. It can't be done.
We've been beating our heads against this wall for many months, and I'm guessing we're not alone. This is happening in the council chambers up and down this coast.
Without the February vote, the ordinance would have gone on the ballot in June. Councilmember Donald Rocha gives credit to the voters for making the council think twice.
These folks showed after that decision, the voters can speak. And I think going forward, we might want to take that to heart and do a little bit better and work a little bit harder to try and come to an agreement before we make a council decision.
Despite the legal confusion, San Jose still aims to be the only city in Santa Clara County to regulate cannabis clubs instead of banning them. That was the goal all along.
Every story has several sides. We'll hear divergent viewpoints when we come back. We'll sit down with a panel of experts and our student reporter when Equal Time returns. Welcome back to this edition of Equal Time. Our focus is medical marijuana. Let's meet our guests.
Hi, I'm Sam Liccardo. I'm a city council member in the city of San Jose, and I was formerly a deputy district attorney here in this county.
Hi, I'm Dale Sky Jones. I'm the executive chancellor for Oaksterdam University.
My name is Tim Vantress. I'm the producer and reporter of the story that just aired.
Very good, and certainly this is a discussion that we want to make clear is a focus on the medical marijuana side, not the general use of marijuana. With that said, you two have very different points of view on this. I'm going to start with you, Dale, on this. Your basic thoughts about medical marijuana and regulation.
Well, one thing that we can agree with, and that I agree with Sam here on, is that we can have safer communities if we control cannabis. But I would go a little further and say that we need to control, tax, and regulate cannabis so that we can shift our priorities away from putting people in prison and start putting them in school. Take these dollars away from the violent criminal cartels and put them into tax dollars that will help our emergency services, our schools, and our law enforcement officers to stay on the street.
Now, Sam, that sounds reasonable, but can we do that in city government?
Yeah, I think we certainly agree in principle about the need to regulate marijuana in an effective way. The reality in terms of criminal prosecution is, for the most part, possession has been decriminalized in the state of California. It's essentially, since Schwarzenegger pushed an effort 2 years ago to ensure that we would not be putting people in prison or jail for mere possession. And in most big city DA's offices, marijuana is not a priority in terms of prosecution. Certainly becomes more of a priority in rural areas. So, you know, the argument about how we're putting people in prison certainly may be a valid argument as we debate legalization of other drugs. For the most part, marijuana isn't putting people in prison. At most, it's putting some people in jail, but it's not what's driving the real problem of criminal justice.
So as we talked earlier, then this issue of regulation means city government or state government or something, but we're in an economic downturn. How can we afford to do that?
Yeah, it's challenging for cities right now because, as you know, cities are suffering enormously throughout the country. Right. Here in California, or in San Jose, I should say, we have 200 fewer police officers than we had a year ago. So it's a real challenge for us to figure out how we can sensibly regulate any kind of operation, particularly one involving drugs, which we simply don't do at the local level. Cities aren't involved in drug regulation. We leave that to the FDA, and for good reason. They have the expertise, the resources, and understanding, and we don't. So we're being asked to really stretch at a time when we're least able to do so.
And then you add the variable that the federal government is opposed to any marijuana use, so they're not exactly going to jump into the middle of this and help you.
It would certainly be nice if we all had a kumbaya moment and could agree on what the law should be. Unfortunately, we don't. At the federal level, it's absolutely prohibited. It's on Schedule I, meaning it can't be used for any medical purpose. At the state, obviously, the people of this state have said differently. Right. And each individual city and county is trying to grapple with that and figure out how to walk the tightrope.
Now, there are people out there watching who use medical marijuana to get through ailments, and doctors have prescribed it, but even the medical community is kind of torn between this issue being a valid one and one that seems to be not appropriate. How does that make you feel, knowing that you have the medical community divided over this?
Well, I'm not sure if you're aware, but very recently the American Medical Association came out in favor of legalization and regulation of all marijuana, not just for medical purposes. And it's because they recognize that the most dangerous part about using marijuana is getting caught with it. Now, I'd like to address one of your earlier points about the criminalization. You're correct in the sense that we're not sending people straight to prison so often. But let's look at our law enforcement priorities. If you look at arrest records, and this comes from our own criminal justice system reports, if you look at who we're arresting, every crime is down on arrests. All violent crimes, crimes against others, property crimes, all other drug crimes are down. Marijuana possession arrests are up 127% over the last decade. That's where our priorities are going. So if we stop having our cops chase pot smokers and have them chase violent criminals, when the amount of marijuana possession arrests exceeds the amount of unsolved violent crime in California, I have to ask where our money is going. It's not just about the tax dollars coming in, it's about where our priorities are when we're spending out.
And I think it's important to understand that to the extent that individual police departments are choosing to arrest people for simple possession, they're receiving citations. They're not going to jail and they're not going to prison.
The first
time.
So
I think it's important not to overstate the nature of that problem. The criminal justice resources that are being devoted in big cities like San Jose, Los Angeles, San Francisco, they're not being devoted to arresting people for possession of marijuana. If there's any marijuana involved in the charge, it's usually for large-scale volume of moving a lot of drugs.
It used to be, but the numbers unfortunately don't bear that out anymore either. And at this point, marijuana possession arrests, minor marijuana possession, now exceeds all of the major trafficking crimes for marijuana out there. It's not just that we're criminalizing people and putting them in prison instead of treatment.
Well, in fact,
it's who we're criminalizing. Well, that's not entirely true, because it's who we're arresting. It tends to be young people. If you look at who we're arresting, it tends to be under 25. Now, study after study has shown that the best way to keep kids off drugs is education and a job. But that one arrest, sure, they don't go to prison, but they have to put that down on their records when they're asked about it. They had problem after problem getting housing, getting into school. And if you're busted with a joint, you now can't get federal funding for school, but you can go to jail. So our entire policy right now is to put our kids in jail rather than in school. And you're right, it's not the first time they're arrested, it's the second and third time. It's the first time that they miss their probation hearing. It's the first time they forget to pay a fine. It's the first time that their parents find out and say, nope, you're on your own. And by the way, they just lost their job because they spent the night in jail. It starts a cycle that criminalizes our youth at a larger rate than the entire European Union combined. So I'm just asking to educate instead of criminalize.
But are we looking at the holistic now? There are the bad players out there.
Absolutely.
That we haven't talked about yet. And Tim, you might want to talk about this. They're the bad players, the people that are organizing this, taking the revenues for bad reasons, because we know government is not able to do all the regulation and control and monitoring. So there are people coming in to make profit off of this, and they're taking advantage of people, and who's protecting them from that?
We would hope that our governments can help us regulate that. It's very difficult to identify the good guys from the bad guys, and this is where I really feel for your position. When you have this feeling of a free-for-all, which is happening right now, and you can't identify who the good guys or the bad guys are, we have to have a set of points to say what are our values as a city, what's important to us. safe access for patients, making sure that we don't create this Walmart situation where everybody's going to one location to find their medical cannabis, and it happens to be the worst neighborhood in town because it's the only place that can be zoned. It should be near a hospital because this is, in theory, a medicine for sick people. We have a very strong, a thriving black market with marijuana. In fact, the government expects that 40 to 60% of the violent Mexican cartels' profits come from selling marijuana here in the US. Right. So I'm just suggesting that we strike the largest blow against these criminal cartels than any law enforcement ever could by simply taking away their profits and focusing on the violent crimes, the other drug crimes that really are damaging our folks. It's a matter of putting them in a position where they can help themselves, and that's not helping in school.
Yeah, I think that's an argument that's well directed to the DEA, Department of Justice, and to the FDA, but it's not an argument that has a lot of relevance to what cities are doing, because the reality is the entity that really ultimately determines drug regulation in this country is at the federal level. And to whatever extent profits are created because black markets exist, they'll continue to exist as long as the federal government decides this is a Schedule I drug.
Right. But as long as there's this division, there's cracks in the system, meaning if you're an organized crime person or if you're just a person who wants to organize an effort to make money off of marijuana, they're going to see the government has limitations, you're trying to do the right thing with medical marijuana, there's an opportunity here, but there's a crack. There's a place where they can thrive.
Now, how do you tell where those cracks are?
Let me ask you though, you don't see Anheuser-Busch and Budweiser taking out Uzis on the street corner. They take out advertising, and we can regulate that. You don't see illegal grape growers in our national forests with machine guns guarding their wine market. It's about regulation. It's about taking it out of the violent cartels, bringing it into the light and saying, no, you won't get a license if you sell to a minor. But the drug dealer out behind the convenience store, he doesn't ID your children. And he doesn't care what else your children are trying. And it's pushing our kids into this hard drug market instead of educating them that the true danger of using cannabis is using too much too young. That there are things, just like alcohol and prescription medication, that have to be taken appropriately with respect to the dangers. A drug in and of itself is not bad. It's how you use it. And we can educate just like we did with cigarettes. We went from 60% down to about 20% smokers here in America, and it wasn't through cracking skulls. It was through education. And we can educate our kids not to smoke pot, just like we educated them not to smoke cigarettes.
But is it part of your responsibility, though, to look at how people think about marijuana and how they use marijuana?
Absolutely.
Because what you said sounds good, but people out there are watching this and they're thinking, now wait a minute here. There are still people who realize recreational use. You mentioned the age group 25 and that general age group. Well, that's your age group, Tim.
That it is.
So let me bring you into here. If young people don't understand the medical part of it, don't have the health issues that require the use of it or the need of it, then it seems always to be recreational, and they use the avenues that you provide to get what they want.
I think it's more of a lack of experience with all these drugs, really. I mean, I think the reason why all these kids are doing all these things, it's the same reason why you see 16-year-olds, 17-year-olds drinking. It's really no difference to them. They still get some kind of ride. It's the experience more than anything. They don't think about the repercussions, really.
But they're using an avenue that you make available, and let's be honest about it, they do it illegally, but they find a way to get the product, okay? I don't want to make it sound like young people are not responsible, because I think most are. But a good number are not, and they're the ones that we're concerned about. If the government cannot regulate it for simply economic reasons, you have to legislate yourselves. You have to make sure young people stop using marijuana illegally.
But telling them stop doesn't work. And we've shown that over and over and over again. If you look at cannabis use, or marijuana usage across the United States, and you look at the criminalization, they're actually not related. The places that allow for medical cannabis use have actually seen a reduction in their youth use, and part of it is we made it boring. It's now a medicine for mom and dad. It's not as fun, it's not as cool anymore because we are discussing it as medicine. But you watch things like prescription drugs take off. Now, you brought up an important point about alcohol. Binge drinking, things along those lines, or just flat having a beer and getting behind the wheel. I mean, all of that is scary for parents. I am one now, so I think about that in a few years. When we look at cannabis as an option, it's safer. And at the end of the day, no one has died from a cannabis overdose death and traffic fatalities are so low that the numbers are not even mentioned in the National Traffic Safety Bureau reports, because even the times that cannabis has been involved, it's been involved with other drugs, prescription drugs, alcohol, falling asleep at the wheel, other types of issues. Now, drug driving is just as much of an issue as drunk driving, but our officers are dealing with that right now.
Now, you deal with parents all the time. Do they understand it the way you just heard it?
Well, I mean, there are a couple concerns. One is, before we draw any conclusions about whether or not drug use goes up or down with the presence of cannabis distribution clinics or dispensaries, we need to recognize data is very difficult to get in this area. And it's hard for us to know exactly what's happening because usually most of the drug use data is self-reported. And when you're dealing with the illicit drugs, it's very difficult to get reliable data. So it's hard for us to know exactly what's happening. I think we all have to concede that. I think it's also important for us to recognize when we're talking about the safety of marijuana as a drug, I'm certainly not going to argue that marijuana is safer, against the notion that marijuana is safer than alcohol. I think we could probably all agree with that. It's undoubtedly safer than virtually any other illicit drug. It's not to say it's totally safe. We still have hundreds of admissions to emergency rooms throughout the state. Because particularly as THC levels have spiked over the years, we recognize that whatever is being tested right now by the FDA is not what we're seeing at the street level. The truth of the matter is cultivators have figured out ways to spike different chemicals within the drug that make it more attractive for users. And as a result, we don't know exactly what's in there, and we don't know exactly what the impacts are. We do know that there are some adverse health effects for some people, and it may be a small percentage of the population that either has an allergy or some kind of reaction with the drug, but we simply don't know. And now the burden is on cities to figure this out, as if we know anything about regulating drugs.
And I'm pretty sure there are people who just heard both sides of this and are saying, wait a minute, there are parents out there who don't agree with any of this. They don't want to see the government get involved with it. They don't want to see you thrive. They don't want to see college students even thinking about that. What about their needs? What about what they want?
Yeah, and the reality is that most of the cities that I'm aware of that have encountered this issue have just said, look, we'd rather not deal with it at all. We'll continue to say it's prohibited within our city limits. City of San Jose is the only city in the county that has said we'll accommodate this because we believe there's value in certainly respecting the will of the voters at the state level and recognizing that there's a medical need here. But the reality is it's mostly the large cities that are doing it that we think might have the resources to be able to figure it out. And most of the small cities are simply saying, we don't want to even get involved in this. You know, we've got a lot of parents who are saying there's no role for us here. We should simply be prohibiting it just like the federal government does.
This sounds like one of those issues that's not going away.
Yeah, you're absolutely right that nobody is happy in the end. Even in Mendocino County, which has the most progressive and liberal marijuana ordinance in the entire country, I believe, they're getting sued by members of the cannabis industry because the regulations aren't progressive enough. Everybody is getting sued on both directions.
Final thoughts, then we have to continue the dialogue. We have to continue looking at the issue, but we also have to be very realistic. There's a demand, there's a public need, there's also a public need for safety and protection, regulation and prevention, education. Sounds like a challenge all of us are going to have to come back and talk about again.
Indeed.
But we're out of time, so I'm going to have to say thank you for joining us. Interesting. Come on back and let's do it again. And we thank you for joining us. We hope you'll come back for another edition of Equal Time.